neurologist at Pantai Hospital, Kuala Lumpur.
And I'm Katyana Azman, consultant psychologist specializing in child and adolescent psychology at Pantai Hospital, Kuala Lumpur.
Today, we will be answering some common questions that parents have about autism.
Dr. Poorani, what are the early signs of autism parents should look out for?
You know, Katyana, the main thing that I see in children with autism is the limited awareness of their surrounding and poor eye contact. Then you have children who do not respond to their names by 8 to 12 months. They have limited babbling, they do not gesture properly. Then they have repetitive or stereotype hand movements or behavior like hand flapping, spinning in circles, or they have a lot of rocking movements. Katyana, can I ask, how would you advise parents on managing their child's meltdowns or challenging behaviors?
That's a tough one. I think any parent who has a child who's on the spectrum, that's probably the biggest thing that they have to manage, right? And so I always tell parents, identify what might be some of the triggers that your child might have. Every child is different. It can be sensory input, it can be overtiredness, it can be any number of things. I always tell parents the primary concern is safety. Make sure that your child and you are not in any harm's way, and then find a way to kind of help your child co-regulate. So if your child is being overwhelmed, find them a calm space that you can take them to, help them co-regulate and calm down, and then find a way to understand your child's triggers. Dr. Poorani, when should a parent seek an assessment if they're concerned about their child's development?
I would think immediately, as soon as the parent has agreed that the child is having some delays or has missed milestones. Okay? Some children, you would notice that they have gained some skills over time and then they have lost the skills, some regression that's happening. Do you think children with the spectrum are able to attend mainstream school?
100%.
Yeah.
And I think that this is something that a lot of parents are afraid of, that my child has to go to a special school.
Yes.
But the gold standard is actually to try to get children into mainstream as quickly as possible. Of course, children who are more severe on the spectrum, who are level 3 and above, might require a lot more support, and because of that, some mainstream schools, especially those that are not inclusive, might not be appropriate. But there are a lot of supports that can be brought in, things like shadow aids or personal learning assistants, having the child enroll in school readiness programs before they join mainstream. So this is something that is absolutely doable, and actually something that we strive to have children do as much as possible. Dr. Poorani, I think the question that a lot of parents have been trying to understand, is autism linked to brain development? And as far as you know, what causes it?
Autism spectrum disorders are a neurodevelopmental condition and definitely due to brain growth. So it's early altered brain growth, functional capacity, and the interplay between the altered connectivity in the brain. Right? So when you ask about causes, then there's a large interplay between genetics, environmental factors like prenatal complications that we sometimes miss or we do not realize, maternal stress, maternal exposure to any drugs, and then advanced parental age.
So if your child is struggling with speech and socialization, there are things we can do to help with that. If your child is struggling with rigid and repetitive behaviors, there are things that we can do with that. We need to part away from the mindset that children who are on the spectrum are low functioning all the time, they are incapable of holding jobs and having friendships and having relationships in the future. So those things are all definitely possible, of course, depending on what level they're at. But even so, I think it's still important that we get them those supports so that we can get ahead of anything.
If you have any questions, please leave them in the comment section below.
And we'll do our absolute best to try to answer them.